In Nigeria, a staggering 167 million people do not have access to hand-washing facilities with soap at home, while 60 million people do not have access to basic water supply. This makes the practice of good hygiene difficult, with devastating consequences on health, socio-economic developments, livelihoods, gender equality, and education outcomes, which have been further intensified as a result of the COVID-19 pandemic.
Lokacin da na ji labarin COVID-19, tsoro ya shiga cikin zuciyata.
To help vulnerable communities be better equipped to protect themselves from the coronavirus and other infectious diseases, WaterAid, with support from the Heineken Africa Foundation, implemented the Scale Up Hygiene project to bring about change in the lives of the poorest and most marginalized in 6 states of Nigeria. Over 21 million people across Bauchi, Benue, Enugu, Ekiti, Kaduna, Oyo States, and in Abuja were empowered with context-specific hygiene information and encouraged to practice good hygiene through different promotional touchpoints.
WaterAid su ma suka sake fadakar da mu, suka faɗa mana yadda za mu iya magance wayannan abubuwan, kuma idan muka ɗauki wayannan matakai ba za mu iya sami wannan ciwo ba, kuma ba za mu mutu ba.
Over 245 non-contact and inclusive hand-washing facilities were installed in healthcare facilities and public places across 6 states of Nigeria. Also, hygiene packs containing soap and face masks were distributed to 30,000 households and 9,000 people with disabilities.
I protect myself through washing of my hands, through wearing of face mask. I wash my hands with soap and water to protect myself against COVID-19 and other infectious diseases.
At least there is changes, because you as a healthcare provider, you are sure of your safety that the clients or patients that are coming in there, they wash their hands. You too, you wash your hands, so you are now sure that you are taking a measure to prevent yourself, your family, and the community at large.
WaterAid and CSO partners advocated for the prioritization and integration of water, sanitation, and hygiene in COVID-19 response plans at state and national levels.
There was this provision of water facility, 700 hand pump boreholes in rural communities, and then rehabilitation of 800 hand pump boreholes, and then more of the hand washing facility were produced in the state and then given to health facilities and other public places based on the advocacy that WaterAid paid to Bauchi State.
Our advocacy work have impacted by way of influencing the state task force on COVID-19 to prioritize water, sanitation, and hygiene in their response as a key preventive measure.
We engage people who are going around the state, enlightening people in public places. We engage also our religious leaders. That's why if you can see the number of COVID-19 impact in Bauchi is drastically low.
Wannan fadakarwan ya taimake mu ba gadama. A yanzu haka bamu da wata fargaba na COVID-19.
Hand washing with soap is a critical first line of defense against the spread of infectious diseases. With support from the Heineken Africa Foundation, we have been able to transform the lives of the poorest and most marginalized in 6 states of Nigeria through the provision of water and hygiene facilities. With people more aware of the importance of good hygiene, and with facilities to support the practice of key hygiene behaviors, people can now better protect themselves and others against the virus and other infectious diseases that are easily transmitted due to a lack of proper hygiene.